ਬਰੈਂਪਟਨ ਦੇ ਮੇਅਰ ਪੈਟ੍ਰਿਕ ਬਰਾਊਨ ਨੇ ਦੱਸਿਆ ਕਿ ਪ੍ਰੋਵਿੰਸ਼ੀਅਲ ਸਰਕਾਰ ਨੇ ਮਿਊਨਿਸਪਲ ਟ੍ਰਾਂਜ਼ਿਟ ਸਿਸਟਮ ਲਈ $150 ਮਿਲੀਅਨ ਦੇ ਪੈਕੇਜ ਦਾ ਐਲਾਨ ਕੀਤਾ ਹੈ ਅਤੇ ਬਰੈਂਪਟਨ ਦੇ ਲਈ $23.4 ਮਿਲੀਅਨ ਦੇ ਪੈਕੇਜ ਦਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਹੈ ਜੋ ਕਿ ਦਸੰਬਰ 2021 ਤੱਕ ਜਾਰੀ ਰਹੇਗਾ। ਉਨ੍ਹਾਂ ਕਿਹਾ ਕਿ ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਪੈਕੇਜ ਬਹੁਤ ਮਦਦਗਾਰ ਰਹੇਗਾ ਕਿਉਂਕਿ ਮਹਾਮਾਰੀ ਨੇ ਟ੍ਰਾਂਜ਼ਿਟ ਦੀ ਰਫ਼ਤਾਰ ਨੂੰ ਹੌਲੀ ਕਰ ਦਿੱਤਾ ਹੈ।
Before we begin, I want to recognize the help from the provincial government for transit. Just yesterday, the provincial government announced $150 million for municipal transit systems, and for Brampton, we're going to be getting $23.4 million up until December 31st, 2021, and that's important. During the height of the pandemic, transit ridership was down 90%, and we've made an effort to maintain our transit routes because we have so many essential workers that need to get to their place of work, and this partnership with the provincial government ensures that there are not going to be deficits in transit in 2021. So thank you to the provincial government and our local minister, Pramit Sarkaria. I also wanted to give an update today on vaccines. Very encouraged that the Osler health system has got off the ground running with an appointment system, an online appointment system. At one point yesterday, we had 6,000 appointments booked over 2 hours. The uptake and interest amongst our seniors has been phenomenal. And so right now, with the supply we've been given, we are vaccinating those 80 years of age and older, or those who will be turning 80 in 2021. This is in addition to the other high priority populations that the hospital is currently vaccinating. As of today, Osler has administered more than 17,200 doses of the Pfizer BioNTech COVID-19 vaccine. This includes nearly 500 residents age 80 and older since this weekend at the Shinkuzi Wellness Center, which is a municipal facility we made available for the purpose of helping with the vaccination effort. And I want to share one story. I went by the vaccination center yesterday, and boy was it well run. Really impressed with Dr. Naveed Mohammed and his team at Osler Health. Really well run. No one was waiting outside. There was physical distancing. It was a fast and an effective machine that was set up to vaccinate seniors in our community. But I went there partly because I wanted to accompany our former Premier of Ontario, Bill Davis, to get his COVID-19 vaccine. And I can tell you, he can still outcharm and outwit anyone around. He wanted to ask every person working where they lived, if they lived in Brampton, because obviously he's proud of Brampton. He even wanted to shake the police officers' hands to thank them for their service, which obviously we can't.
ਬਰੈਂਪਟਨ ਦੇ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਲਾਰੈਂਸ ਲੋ ਨੇ ਦੱਸਿਆ ਕਿ ਬਰੈਂਪਟਨ 'ਚ ਇਸ ਹਫ਼ਤੇ ਪੋਜ਼ਿਟਿਵਿਟੀ ਦਰ 8.7% ਰਹੀ ਹੈ ਜੋ ਕਿ ਪਿਛਲੇ ਹਫ਼ਤੇ 7.4% ਸੀ। ਇਸ ਹਫ਼ਤੇ ਪੋਜ਼ਿਟਿਵਿਟੀ ਦਰ 'ਚ ਥੋੜਾ ਵਾਧਾ ਹੋਇਆ ਹੈ। ਨਾਲ ਹੀ ਕਰੋਨਾ ਵੈਕਸੀਨ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੰਦਿਆਂ ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਇਸ ਹਫ਼ਤੇ ਕਰੋਨਾ ਵੈਕਸੀਨ ਲਈ ਰਜਿਸਟ੍ਰੇਸ਼ਨ ਦੀ ਸ਼ੁਰੂਆਤ ਕਰਕੇ ਮੀਲ ਪੱਥਰ ਕਾਇਮ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ।
This week, Brampton's test positivity is at 8.7%, which is up from 7.4% last week. Our weekly incidence rate is at 128.1 cases per 100,000, which is up from 115.1 cases per 100,000 last week. This week, we hit a milestone worth celebrating. Online registration for vaccination started for residents 80 and older at our 2 hospital sites in the region of Peel, and some residents have already gotten vaccinated. I want to thank our hospital partners, and in Brampton specifically, our partners at William Osler, for their partnership and collaboration in offering this protection to this important group in our community. I also want to say that while appointments are limited in supply, I am glad that we have been able to start one small step in vaccinating and providing protection to all of our residents, starting with our oldest and most vulnerable. I also urge patience. If you can't get an appointment right away, please try again. More appointments will become available as more supply is received. The future is bright, and I know that we all want to get back to normal. The vaccines are one part, though it is really your sacrifices to date that have got us part of the way there. Unfortunately, we are seeing a reversal of the favorable trends that we've observed in the last 5 weeks, and this is driven by the growth of variants of concern and the loosening of measures in other jurisdictions. From 5 cases just 2 weeks ago, we now have over 100 confirmed cases of confirmed variants in our community and 600 that have screened positive. And these numbers give me pause. In this race between vaccine and variants, we know that we have limited vaccine supply at this time and rapidly accelerating variants. Our hospitals are also seeing admissions related to spread of variants, and while ICU occupancy has improved from the peak of the second wave, they still remain at levels similar to what we saw in Wave 1 in spring 2020. Reopening too quickly risks erasing the gains that we've made, putting lives and well-being at risk. The UK saw a third wave when they reopened with variants in their midst, and nobody, myself included, wants to see that. We must try to keep what happened there from happening here.
ਪੀਲ ਡਿਵੀਜ਼ਨ ਦੀ ਖੇਤਰੀ ਕਾਉਂਸਲਰ ਰਵੀਨਾ ਸੈਂਟੋਸ ਨੇ 8 ਮਾਰਚ ਨੂੰ ਮਨਾਏ ਜਾਣ ਵਾਲੇ ਅੰਤਰਰਾਸ਼ਟਰੀ ਮਹਿਲਾ ਦਿਹਾੜੇ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ। ਉਹਨਾਂ ਦੱਸਿਆ ਹੈ ਕਿ ਇਹ ਦਿਹਾੜਾ ਲਿੰਗ ਅਨੁਪਾਤ ਵਿੱਚ ਬਰਾਬਰਤਾ ਲਿਆਉਣ ਲਈ ਬਹੁਤ ਹੀ ਮਹੱਤਵਪੂਰਨ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਇਸ ਦਿਨ ਔਰਤਾਂ ਦੀਆਂ ਸਮਾਜਿਕ, ਆਰਥਿਕ, ਰਾਜਨੀਤਿਕ ਅਤੇ ਧਾਰਮਿਕ ਪ੍ਰਾਪਤੀਆਂ ਨੂੰ ਮਨਾਇਆ ਅਤੇ ਸਨਮਾਨਿਤ ਕੀਤਾ ਜਾਂਦਾ ਹੈ। ਇਸ ਦਾ ਮਕਸਦ ਔਰਤਾਂ ਨੂੰ ਸਮਾਜ ਵਿੱਚ ਬਰਾਬਰਤਾ ਦਾ ਹੱਕ ਦੇਣਾ ਹੈ।
In lead up to International Women's Day on Monday, March the 8th, it is so important that we continue that conversation around achieving full gender equality, especially in the context of this global pandemic. International Women's Day celebrates the social, economic, cultural, and political achievements of women, and it also marks a call to action for accelerating women's equality. COVID-19 has amplified many of the existing gaps in our systems that need our continued focus and action. Women in the first wave of this pandemic were disproportionately affected. So let's acknowledge that as we continue to push that a gender pay gap still exists in this country, which makes this pandemic financially harder on women. And also, many of our essential workers are women, many of whom do not have access to paid sick days. We need paid sick days. We must also recognize that fundamental to achieving transformative change is the safety and well-being of women. Between economic and social stressors, coupled with stay-at-home measures, gender-based violence still remains a serious concern in our community. We have seen firsthand here in the region of Peel. According to Peel Police, the highest number of calls that they receive are based on family and intimate partner violence. In 2020 alone, Peel Police reported 5,431 violations related to domestic disputes and disturbances in Brampton and 4,165 violations related to family disputes and disturbances. These numbers are not okay, and it's why, together with the region of Peel, we launched an awareness campaign titled It's Not Okay. I want to take this moment to share, if you or someone you know needs support, please know that you could call 211 24 hours a day, 7 days a week. And if this matter is an emergency or life-threatening, make sure to call 911. This morning, I would also like to recognize the women in our organization and community who are rising up and taking their place at decision-making tables to actively make space, safe space. From our women leaders who have been driving our COVID-19 social support task force throughout the pandemic, and to the women leading our emergency response and economic recovery.
ਓਨਟਾਰੀਓ ਦੇ ਕਿਰਤ ਸਿਖਲਾਈ ਅਤੇ ਹੁਨਰ ਵਿਕਾਸ ਮੰਤਰੀ ਮੋਟੇ ਮੈਕਨਹੌਟਨ ਨੇ ਮਹਾਮਾਰੀ ਦੌਰਾਨ ਪ੍ਰਭਾਵਿਤ ਕਾਰੋਬਾਰਾਂ ਅਤੇ ਕਾਰਜ ਸਥਾਨਾਂ ਦੇ ਨਿਰੀਖਣ ਦੀ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ ਹੈ। ਉਹਨਾਂ ਐਲਾਨ ਕੀਤਾ ਹੈ ਕਿ ਸੂਬਾਈ ਸਰਕਾਰ ਨੇ ਗੁਦਾਮਾਂ, ਵੱਡੇ ਬਾਕਸ, ਪ੍ਰਚੂਨ ਸਟੋਰਾਂ ਅਤੇ ਖੇਤਾਂ 'ਚ ਕੰਮ ਕਰਦੇ ਕਾਮਿਆਂ ਤੇ ਧਿਆਨ ਕੇਂਦਰਿਤ ਕੀਤਾ ਗਿਆ ਹੈ। ਇਸ ਲਈ ਪ੍ਰੋਵਿੰਸ ਪੱਧਰ ਤੇ 100 ਤੋਂ ਵੱਧ ਸਿਹਤ ਸੁਰੱਖਿਆ ਇੰਸਪੈਕਟਰਾਂ ਦੀ ਨਿਯੁਕਤੀ ਕੀਤੀ ਗਈ ਹੈ।
Good afternoon, everyone. Thank you for joining me today. It's hard to believe it's been almost a year since our lives first got turned upside down. For those with office jobs, it meant getting in cars only for essentials with a mask in hand. But many people had a different experience. Their jobs couldn't be done from home, like cashiers, construction workers, farmers, truck drivers, warehouse and distribution center workers. These are Ontario's heroes. Every day, they roll up their sleeves to do a hard day's work. We owe them our thanks, but we also need to do everything we can to keep them safe. At the start of this year, I launched a province-wide Stay Safe All Day campaign focusing on areas of high transmission such as break rooms and work vehicles. The last thing we want is for people to let their guard down and catch or spread this virus, including one of the many variants, over a cup of coffee. Our campaign was followed up with blitzes that zoned in on sectors where extra support was needed, such as warehouses, big box stores, and farms. This proved to be the right approach. For instance, our big box blitz saw compliance with public health guidelines increase by almost 19% over the course of 3 weeks. Our warehouse and distribution center blitz in Peel region found 57% of these businesses were in compliance, but more needed to be done when it came to workplace safety plans, screening, and masking. And in Toronto, we are working with local public health officials to tackle the hotspots that they are seeing. I'm pleased to say we are making progress. Employers are learning, improving, and stepping up. Since the start of this year, over 11,800 workplace inspections have been completed and over 9,400 orders and 370 tickets have been issued. Each visit we make is one more step towards making our workplaces safer. As we continue to move forward, we're increasing our efforts. On Monday, more than 100 new occupational health and safety inspectors started their training.
ਟੋਰਾਂਟੋ ਦੇ ਮੇਅਰ ਜੌਨ ਟੋਰੀ ਨੇ ਯੋਂਗੇ ਸਟਰੀਟ ਦੇ ਵਾਪਰੇ ਦੁਖਾਂਤ ਬਾਰੇ ਬੋਲਦਿਆਂ ਕਿਹਾ ਹੈ ਕਿ ਉਹਨਾਂ ਪੀੜਤ ਪਰਿਵਾਰਾਂ ਲਈ ਨਿਆਂ ਦਾ ਬੂਹਾ ਕਦੇ ਵੀ ਬੰਦ ਨਹੀਂ ਹੋਵੇਗਾ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਜਦੋਂ ਤੱਕ ਕੇਸ ਕਿਸੇ ਅਮਲ ਤੱਕ ਨਹੀਂ ਪਹੁੰਚ ਜਾਂਦਾ ਤਾਂ ਪੀੜਤ ਪਰਿਵਾਰ ਨੂੰ ਹਰੇਕ ਸੰਭਵ ਮਦਦ ਦਿੱਤੀ ਜਾਵੇਗੀ। ਪੀੜਤ ਪਰਿਵਾਰਾਂ ਦੇ ਮੁਖਾਤਬ ਹੁੰਦਿਆਂ ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਟੋਰਾਂਟੋ ਨਿਆਂਪਾਲਿਕਾ ਤੇ ਪ੍ਰਸ਼ਾਸਨ ਹਮੇਸ਼ਾ ਤੁਹਾਡੇ ਨਾਲ ਰਹੇਗਾ। ਉਹਨਾਂ ਦੱਸਿਆ ਹੈ ਕਿ ਹਿੰਸਾ ਅਤੇ ਅਜਿਹੇ ਘਿਨੌਣੇ ਅਪਰਾਧ ਦੇ ਖਿਲਾਫ ਟੋਰਾਂਟੋ ਹਮੇਸ਼ਾ ਇਕਜੁੱਟ ਰਹੇਗਾ।
Today, Superior Court Justice Anne Malloy has delivered a guilty verdict in the murder of 10 innocent people in our city and on all 26 counts in the indictment related as well to people who were injured. While there will never be complete closure for the families of those who died, those who were injured, or for the city itself, the conclusion of these proceedings will help, and Justice Malloy deserves our profound thanks for her handling of a very difficult case. My focus today, as it has been every day since this terrible tragedy took place on Yonge Street, is on those 10 innocent people who lost their lives, on the 16 innocent people who were injured, and all of the friends and the families and the bystanders and the first responders, many of whom I have met with on your behalf since that time, because their lives were forever changed by this tragedy. Since that day, we have been working hard as a city to help the survivors to heal and to move forward and to support the families as they continue to mourn their loss. I truly hope that for the victims and their families and friends, today's verdict will help them. Nearly 3 years ago, our entire city was rocked by this heinous act of violence right in the heart of North York. I want those who continue to be impacted by this tragedy to know that Toronto is with you and that we all continue to support you. We will remain forever grateful for all of our frontline heroes, police officers, paramedics, firefighters, and special constables who responded to help people that day, and all the bystanders who provided aid to those people who were suffering in those terrible moments. I also want to thank the Toronto Police Service for conducting a thorough, comprehensive, and very professional investigation that helped to lead to this verdict. Make no mistake, this was an attack fueled by misogyny and hatred of women, and should be regarded as such. We must all stand up against this kind of hateful behavior and those who promote it. Today, I want to remind residents, because this is the most important thing of all, I want to remind residents of the names of those lives lost, which bear repeating so that we will never forget them. Renuka Amarasinghe, Andrea Braden, Geraldine Brady, Anne-Marie D'Amico, Sohee Chung, Betty Forsyth, Chulmin Eddie Kang,
ਟੋਰਾਂਟੋ ਦੀ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਐਲਨ ਡਿਬੇਲਾ ਨੇ ਸ਼ਹਿਰ ਅੰਦਰ ਕੋਰੋਨਾ ਵਾਇਰਸ ਦੀ ਤਾਜ਼ਾ ਸਥਿਤੀ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੰਦਿਆਂ ਦੱਸਿਆ ਹੈ ਕਿ ਅੱਜ ਸ਼ਹਿਰ ਅੰਦਰ ਕੋਵਿਡ-19 ਦੇ 290 ਨਵੇਂ ਮਾਮਲੇ ਰਿਕਾਰਡ ਕੀਤੇ ਗਏ ਨੇ। 285 ਮਰੀਜ਼ ਹਸਪਤਾਲਾਂ ਵਿੱਚ ਭਰਤੀ ਹਨ ਅਤੇ 62 ਗੰਭੀਰ ਮਰੀਜ਼ ਹਸਪਤਾਲਾਂ ਵਿੱਚ ਜੇਰੇ ਇਲਾਜ 'ਚ ਨੇ ਅਤੇ ਮੰਦਭਾਗੀ ਖਬਰ ਦਿੰਦਿਆਂ ਉਹਨਾਂ ਦੱਸਿਆ ਹੈ ਕਿ ਕੋਵਿਡ-19 ਦੀ ਚਪੇਟ 'ਚ ਆਏ 5 ਮਰੀਜ਼ਾਂ ਦੀ ਮੌਤ ਹੋ ਚੁੱਕੀ ਹੈ।
Today, I am reporting 290 new cases of COVID-19. 285 people are in hospital and 62 people are in the ICU. I'm sorry to have to report as well an additional 5 deaths. 1,468 cases have screened positive as likely variants of concern. We have 126 cases that have been confirmed as variants following laboratory testing. 122 are the UK variant B117, 3 are the Brazilian variant, and 1 is the South African variant. The variant figure is not what I want to see. A week ago, the screened positive number was 710. So in a week, the number of cases screening positive for a variant has more than doubled. I have said throughout the pandemic that I am guided by the facts as they are. I have never decided easily to recommend restrictions for Toronto. I understand that each course of action comes with benefits and costs. Overall, case counts at present call for a cautious approach that will allow us to reopen and to do so as safely as possible. Based on the data in front of us, it is clear that reopening widely, such as under the red category of the provincial framework, is not advisable at this time, given our current case counts. Moving out of the stay-at-home order is a reasonable course of action for Toronto. Although I will add that while there are evident reasons for a change in status, there remain reasons or risks that underscore how moving back into gray status is and will be a delicate balance. It comes down to our choices in our daily lives. Our ability to make the right choices is the reason a move in this direction is possible.
Panj